Hi, everyone. So my name is Hannah Tislarch, and I'm going to be presenting my program model assignment. So the program aim that I created was to allow rehabilitation counselors to work on anxiety levels with students with disabilities that are transitioning from grade to grade. The age group that I'm focusing on is 11 to 17-year-olds. The students, and also the focus is on students who have mental and physical disabilities who struggle in class, and they also attend private school. So some predicted needs are children with disabilities do not have the same services provided to them that students in public schools are allowed. They are largely underserved population on private school campuses. A quote that I found says that evidence shows that schools enhance both access to and quality of mental health supports and services, while current community systems is limited to the youth. They can be unaware of services and resources available outside of their campus and in their community. And working in the community and having private schools be aware of the resources can help the families and students coping with that disability. So some objectives, my first one is allowing more fluid and normal lifestyle to individuals who feel held back by their disability in the classroom by graduation. Number two is having the same resources offered to them like public schools offer to their students. A lot of times private schools don't have those types of connections or those sources on their campus. And the third one is having assistance in the classroom or outside the classroom with testing, study tips, or learning material to have overall better grades and confidence. So the stakeholders would be the students who are coping with their disabilities on a daily basis, their parents who are trying to help them navigate their students through the school system and helping them with their disability as well. The teachers need to allow the assistance for their students and support them throughout the process. And then administration of the campus, knowing the community-based resources. The school counselors on the campus can also benefit the student and help support them. And then the community counselors who are working and supporting these students with building their academic skills and decreasing that anxiety. So the measure program success, to measure success is by seeing the anxiety levels decrease and the students transition grade to grade. We're hoping anxiety levels on the assessment should decrease by like 40%. One of the way to assess kids who have been referred is using the multidimensional anxiety scale for children, also known as the MASC assessment. The end goal is decreasing anxiety levels by students by the end of the school year. And throughout the 10 months, to reassess anxiety levels in students every 2 months to see how meeting with the rehabilitation counselor with the support of the school counselor has helped them. And that assessment we'll be using is the Beck Anxiety Inventory Assessment. So actual problems would be like large number of students at private schools with disabilities needing the help of a counselor and not being able to provide that much resources. Counselors take on too many caseloads and too many students. The school shows interest in working with the counselors, but then doesn't and kind of falls through, which then has the students lack that help and support. Use of specialized mental health clinics can become costly for schools and our families, so trying to figure out how to problem solve around that. And a program that I'm going to talk about later is that parents do not fully stick to the Cool Kids program that is going to be a part of the process. So some potential problems that could happen are kids become unmotivated to meet with the counselors. Counselors leave the job and can go elsewhere during the whole program. So that makes it hard for the counselors and kids to build rapport, which is important, and there's no trust in the therapeutic process. There could also be a lack of space, and a lot of kids are needing assistance. So some evidence-informed action plan, I found a few resources. One states that schools are the main point of entry into the mental health service system for youth, with one study showing that more than 70% of mental health treatment for youth is provided by schools. Another one is that CBT is an effective gold standard treatment for anxiety that targets unhelpful thoughts and feelings to maintain that anxiety. Trying to accomplish the students to build self-awareness, self-management, social awareness, relationship skills, and responsible decision-making. This will lead to decreased anxiety in the classroom and help transition to their future endeavors. Services include individual and group therapy. So a few interventions. There's one intervention that was been utilized in Australia, and it's called Cool Kids, which is a cognitive behavioral intervention for anxiety symptoms in children, but it's all offered online, and it's about a month program that the kids and the parent can do together before going into the cognitive behavior therapy that the rehabilitation with the assistance of school counselor will provide, along with the CBT therapy. It'll be utilized as CBT components, psychoeducation, Black and white thinking, cognitive restructuring, and exposure to anxiety-provoking situations. So a few steps are getting clients, and to do that is to post flyers around the community, on campus, social media, school website, and maybe even a school-wide meeting with the parents and students with the counselors, just to kind of put the program out there and see who would actually want to utilize it and benefit from it. The next step is to implement the program. So the sessions can be held on campus or at counselor's office, whichever is probably easiest for the student and parent, especially with transportation problems. Services will be offered, or the services will be offered by LPCCs and CRCs, and then the school counselor will be there to assist. The duration would be a school year, so from August to May. To collect data, we'll be using the assessments and their Likert scales to show the base level of anxiety and then assess the decrease of the levels during treatment and then at the end of treatment. A few steps continued are some of the needs that I found, is that some research said that the Community Preventive Services Task Force recommends the universal school-based CBT programs to prevent or reduce depression and anxiety symptoms among school-aged children and adolescents. Another one states that evidence from included studies showed universal school-based CBT interventions led to small reductions in depression and anxiety symptoms among children and adolescents when compared to control groups. The outcomes were similar in the subset of studies from the United States and the overall body of evidence for depression. So the plan of action is before the school opens in August, they can meet with the school and agree with the work to work together with the students who have these disabilities. Month one, the counselor will be growing their caseload and finding clients in the school system who need the help. And with that caseload, those kids and parents will start the Cool Kids course online. For month two, they will meet with the new clients during intake and assess anxiety levels. And then between months 3 and 4, during the first of every other month, they assess the anxiety levels with clients to see how the clinician can help more and benefit them off the treatment to decrease those levels. And then month 10, discuss transitional plans and the final assessment, which leads to termination and the hope that their anxiety levels decrease. So the implementation, the project goal is decrease anxiety in students with disabilities in private schools. Outcomes, expected results is the students will have less anxiety and get assistance with school needs from a counselor. Potential risks are delay in getting clients, cost, no counselors, and tasks or have clients assigned by month 2 of school and have decreased anxiety levels throughout the school year. And this will help them grow more confidence in moving between grade levels. So the evaluation, the client seeking help will have an intake session where they will take the initial assessment. That assessment, like I stated, is the multidimensional anxiety scale for children. The clients will begin with their families on Cool Kids to get insight and psychoeducation tools for them and their parents. So just like a base course, a little start off with the tools. And then the counselor will then assess how often the student can meet with them, what tools they will need in the classroom to lower anxiety levels, and improve in the classroom if need be. They can also hold group sessions with kids who may be struggling in certain aspects of their program. Some evaluation continued. They will take the Beck anxiety inventory with their counselor every other month to assess the anxiety levels and see if they have decreased or increased or decreased. And then at the end of the school year, they will take the final assessment going back to the one that they did in the beginning, which is the MASC assessment. They'll take that with the counselor in hopes that their anxiety levels have decreased. So the results will show at the end of treatment a decrease in the client's anxiety levels after their work with a counselor. The multidimensional anxiety scale for children assessment will be taken at the end of the program, and throughout this program, utilizing the Likert scales, we hope that it shows that they have low anxiety levels, and that will show a decrease in the anxiety levels. Recommendations for the future is start off using rehabilitation counselors and school counselors for group. And then utilizing that and being able to establish school-based interventions for anxiety disorder to be delivered by school personnel. A lot of schools don't have their school counselors trained in this type of therapy, which is the CBT. So not having for them to work together will help utilize and open up more doors for more clients and more caseloads if rehabilitation counselors and school counselors can be working from the same community-based resource. And these are my references, and that is my presentation. Thanks for watching.